us today will be Rebecca Deutsch, who serves as the certification manager of the American Board of Lifestyle Medicine. Beck has been a driving force behind ABLM for many years now. She also is the MOC manager on the global stage for the International Board of Lifestyle Medicine. And anyone that's calling into ABLM, you will often have the benefit of being assisted by Beck. And also Dr. Brenda Rea, who is a founding member of the American College of Lifestyle Medicine. She's a former board member of both the American College of Lifestyle Medicine and the American Board of Lifestyle Medicine. She serves as the medical director of the education department of ACLM. And also is the executive director of the Lifestyle Medicine Residency Curriculum. And so we're so pleased to be joined by both Beck and Brenda, and we'll turn it over now to Dr. Brenda Rea.
Thank you so much, Susan. It's wonderful to be here with all of you guys and to get to speak a little bit about certification. The first thing we're going to dive into is, why does it matter? Why do we even want to get certified? So let's flip to the next slide. All right, so this is not an exhaustive list, but these are the high points that I really wanted to talk about with you guys. Really, if you become certified in lifestyle medicine, what it does is it really helps you demonstrate the desire to practice at the highest level. So the people who really are interested in lifestyle medicine and who feel that this is an important next step in their career, getting certified really shows that you have the highest level of expertise. And so you can see the second point, it says it provides ongoing validation. So it's really validating the information that you've learned and the expertise that you have developed, both in experience, also knowledge, and also your skills. And here's the big next step that's really important is the job market is really starting to step up and to recognize the lifestyle medicine certification. So it prepares you for future job opportunities. There are some job opportunities in health systems that are actually looking for people that have the lifestyle medicine certification. And if you have two equivalent physicians or health professionals, and one has a lifestyle medicine certification and one does not, the advantage is always going to go to the person that has the lifestyle medicine certification behind their name, which is really exciting to see a growing and growing demand for this certification. So what it really does is it gives you a pretty strong competitive edge when you're in the job market. And I'd like to say that these last two bullet points are really, really significant. So many of us went into the healing fields of medical professionals really because we wanted to be able to help other people and to serve other people. And so lifestyle medicine really helps bring back that core sense of self-fulfillment for why we went into the healing medical professions to begin with. And so this is super, super important. And I can't tell you how many times I've heard this over and over and over again. It's really exciting. And so the last point here is also extremely important. So as you're learning about lifestyle medicine and becoming certified, completing all the prerequisites, and then practicing, what it does is it really supports your own personal growth and well-being. We know that as health professionals, physicians and healthcare providers, we know that burnout is real. We know that the demands on us are great, but yet we still serve and we want to serve. But this lifestyle medicine education and knowledge and ability to practice differently, it really enables us to support our own well-being. So these are all really strong points for you to think about in consideration for certification as you think about it. Again, I'm going to say from the beginning, just do it. If you're even thinking about it, just do it. You will not regret it. All right, let's talk about next slide. What I want to do now is talk to you about the overall certification framework. So first of all, we have frameworks and certification for physicians and for health professionals. And so on the left side, you actually see that the ABLM and IBLM for physicians, there's two levels of certification. Number one, you have the lifestyle medicine physician was the foundational certification. And then you have the lifestyle medicine intensivist, which is not an additional exam, but it's additional requirements that really show that you have the competence clinically to put disease into remission and work towards reversal. And so this is really, really exciting. We have both experiential and educational pathways for a physician. Now, on the right side, we have the ABLM and IBLM non-physician or lifestyle medicine health professional. And so that's another pathway. So it's really important to think about the American College of Lifestyle Medicine certifies the health professionals, and American Board of Lifestyle Medicine and International Board of Lifestyle Medicine certify the physicians. And this is a really important distinction as you move forward, because you will actually, your designation will be different. For professionals, it'll be diplomate of ACLM, and for physicians, it'll be diplomate of ABLM or IBLM. So very important distinction. Let's go to the next slide. Okay, so let's just dive a little bit deeper into the two pathways for the physicians. So I talked about for the physicians, you have experiential pathway, which is on the left, and the educational pathway, which is on the right. They both equally result in certification and qualification for certification. Let's talk about the experiential pathway first, which is on the left. So the prerequisites are that you need to be board certified for at least 2 years. So in other words, prove that you have experience. Post-residency, board certified for 2 years. And then you see there's 3 requirements. The first one is that you need to have 30 hours of an online course that's a CME course that's approved by ABLM or IBLM. You need a 20-hour of approved event CME. So you go to an actual event, whether it's virtual or in person. And then you complete a case study, which is a templated case study that shows that you have experience with lifestyle medicine. It can even be your own personal story. If you want to create your own personal story and put that into the case study, that's okay. Let's hop over to the right side, which is an educational pathway. So the educational pathway was created by ABLM and IBLM. And what it is requirements that someone can complete when they're in their educational pathway, so primarily through residency. What we did is we took those requirements that ABLM had outlined, and we created a curriculum that met all those requirements, and that curriculum became known as the Lifestyle Medicine Residency Curriculum, or the LMRC. The LMRC now is implemented into over 170 residency sites across the nation and over 370 residency programs. And so this is a plug and play curriculum that if a site wants to adopt it and implement it, then their residents can complete the full curriculum and then be qualified to sit for their certification exam when they graduate from residency. And it's basically 100 hours of didactics. It's a practicum component. And then the residents and faculty can both do it together, and they need to be primary board certified, graduate from residency, be board eligible, and then they can actually sit for the certification exam. So what does the exam actually look like? Oh, I'll just say one other thing about the educational pathway. If you do not want to implement the lifestyle medicine residency curriculum, we also have some other options for equivalency pathways where sites can say, oh, we're already meeting all these requirements. And so we can do some approval processes for these other sites. And we have a few other sites that have applied for this and do meet the criteria. We've also created an equivalency pathway that actually starts in medical school and moves from medical school on to through residency, so that we can actually start the educational process in the medical school system. And we actually have a certification of medical schools that teach lifestyle medicine that can be a part of this equivalency pathway. So for those of you guys who are involved in medical education, medical school, and residency, I encourage you to reach out to us and think through the educational pathway and how you can support. We know that when health professionals and physicians, as they go through their training, if they're learning how to integrate lifestyle medicine from the very beginning in their training, we know that these practice patterns will carry through their career. And so we're really excited about being able to offer some of these options for them. Again, they all lead towards board certification. We just have many paths towards board certification in the education pathway. So the exam itself for physicians is 150 questions that are multiple choice. We have it in multiple languages. You get certification jointly by American Board of Lifestyle Medicine and International Board of Lifestyle Medicine. And like I was saying before, you're a diplomate of ABLM or diplomate of IBLM, and you are called a certified lifestyle medicine physician. Next slide. Okay, there's 2 pathways now for health professionals, so let's just walk through them. The experiential pathway is actually exactly the same for health professionals versus physicians minus the case. The health professionals don't need to do the case. So again, you need to be a primary health professional degree, which is master's or above, and then you do the 30 hours of online CME course and 20 hours of approved event CME, and then you do not have to do the case. Let's flip over to the far right, and this is the academic pathway for the health professionals. And there are two pathways. There's a partial academic pathway and a full academic pathway. I'm going to focus on the partial academic pathway. What this is this health professionals that are actually in an academic program. They're a student in a master's or above program. And in that program, they will actually complete the same as the experiential pathway, the 30-hour online course CME. But instead of the event, the 20-hour event, they actually can get credit for a course that they're taking in their program. And that course gets approved and accredited, and they need to get a B minus or above, and then they get credit and a waiver for completing the course instead of having to do the approved event, the 20-hour approved event. And so this is really great. We have quite a few programs that are moving in this direction. It's really exciting to see, again, the certification process start in academic programs, which is wonderful. So as we move forward, I need to think about the exam. How does the exam differ? The exam really is just 120 questions instead of 150 for the physician. So they have 30 less questions. And again, we have the same languages. And here, this is the difference. The certification is by ACLM here in North America, and then IBLM internationally. So you become a diplomate of ACLM here in the US, and you're called a certified lifestyle medicine professional, and that's your nomenclature. Next slide. So the certification competencies really are divided based on the ABLM, IBLM weighted competencies. And you can see here that the greatest percentage of time is spent in nutrition. 26% of it is nutrition. The next largest category is physical activity at 14%. And then you can see the step down of the different percentages of weighting of the exam. And the CME event, well, I shouldn't say CME event. The CME online course actually is dedicated to helping you prepare with the similar weighted competencies. So a majority of the time, 26% of it is on nutrition and so on. So you'll see that outlined in the 30-hour online CME that's required for many of the pathways. Next slide. All right, so now I'm going to turn this over to Beck, and she's going to finish off with how to get certified. What are the nuts and bolts of how to go through the process?
Thank you so much, Brenda, and hi, everyone. Nice to be with you today. Thanks so much for joining us. We'll just move on to the next slide. And one thing I wanted to mention while Brenda went over the nomenclature and who certifies which type of professionals, so the ABLM manages and coordinates exams for all candidates. So your questions will make their way to us if you are sending in certification questions. So here are our recommended steps. There are some other options for your events and your coursework. You can find those via our website, www.ablm.org. There's a section specifically eligibility and prerequisites, but here's what we recommend. To first become a member of the American College of Lifestyle Medicine so that you can take advantage of the wonderful benefits Susan discussed a bit earlier. Then enroll in the board review course, which again is specifically designed for examinees. And then we recommend registering and attending the Lifestyle Medicine 2025 event. And we do accept CME up to 36 months old from the date of your exam. So anything from 2022 on, if you took an eligible course or attended an eligible event, we will still accept that this year. Next, you have to register by September 30th of the year you wish to sit for the exam. The deadline closes at 6 p.m. Pacific that day. And the case study is available on our ABLM website, and that is for physicians only. And then we ask that you submit all prerequisites 30 days prior to exams. But this is one of the most frequently asked questions we get. Can you sit for the exam even if you're going to attend the event just before exams? Yes, absolutely. Please do. So while we like to get those prerequisites 30 days prior to exams, the events immediately preceding exams are always exceptions to the rule. So yes, absolutely. Please attend. And next slide, please. And again, the Foundations of Lifestyle Medicine Board Review course specifically for examinees. My favorite thing about this course is that it comes with a hard copy manual. That's one of my study preferences, and I hear the same from a lot of other diplomates that they prefer to have that hard copy study guide. And next one, please. And this year's Lifestyle Medicine Conference is in Grapevine, Texas, November 16th through the 19th. I hope to get to meet some of you in person there. These are wonderful opportunities to network with people with a shared passion. And we have so many wonderful whole food plant-based meals together. It's a really great experience. So I hope to see you there. This lifestyle medicine question bank was designed to help you get an idea of the way the questions are structured. So while we're not necessarily going to give you any questions that are on the exam, it will give you some great practice if you'd like to do this. And it also has 8 CME or CE credit hours tied to it. It's not an exam prerequisite, but just an additional option if you'd like to practice with questions. Okay, so our exam weeks this year is running November 22nd through December 7th, 2025 at a parametric testing center of your choice. What happens is when candidates register by September 30th, that guarantees that you'll receive an invite to reserve your seat at a parametric testing center, but we do not send those invites until shortly post-close of the registration deadline of September 30th. That's when the coordination of global exams begin. So there's no way to schedule your exam prior to September 30th. We get that question quite frequently as well. And again, the deadline closes at 6 p.m. Pacific on September 30th. And you can register by visiting www.ablm.org. There's going to be a button that says Enroll Now for the 2025 exam. And then you'll be bumped over to this site, which you'll register as an exam registrant. And it's pretty self-explanatory from there, but you can simply reach out to us with any questions by emailing info@ablm.org. And I won't go over the pricing, but you can see the difference in pricing, whether you are an ACLM member or not, or whether you're a physician or a health professional, if you'd like to screen capture this one. And I won't go into any further details for that. And Susan mentioned our incredible growth over the past several years. Since 2017, there are over 8,000 diplomates certified globally, which is incredible to see. And you see some of the spots with the biggest circles there. Lots of growth in Europe, plenty in Asia, all continents at this point. And it's just a wonderful thing to be a part of because lifestyle medicine is a global language. The pillars are the same internationally. So we're all talking about the same thing. And next slide, please. We have 3,810 certified physicians in the US since 2017 and 1,314 professionals. To be certified, you have to have a master's degree or higher in a allied health field. If you have any specific questions regarding your eligibility, you can send those to us at info@ablm.org. And the maintenance of certification program is for anybody who has recently sat for the exam. So if you become certified this year in 2025, we will send you invites as soon as we get into the next year. You'll have to sign up by March 31st, the year immediately following your initial certification. And we collect an annual fee for the program. It varies based on whether you're a professional or a physician, and it's also tiered by country. If you have specific questions, please send those over as well. And we have an MOC CME committee made up of members around the globe who selects articles, and you have to answer 80% of the questions correctly on 3 different quizzes and unlimited attempts to take them. That is one of the components. And then you have to submit 30 hours of lifestyle medicine specific CME every 5 years. And for physicians and advanced practice providers, you have to maintain your primary board certification. And the participation in the MOC is required annually. If you miss out, we do have a grace period, but if you miss out on the initial opt-in period, or if you let the grace period go by, we unfortunately cannot get you back in. So the year following your initial certification, please sign up. We'll send you lots of emails to try to remind you. Okay.
Awesome. Thank you, Beck, and thank you, Brenda. We have quite a few questions coming in. And just kind of first question is really about international, kind of eligibility and making sure that everyone on the call understands that our international counterparts have the same requirements. It just goes through IBLM. Is that correct?
So it's going to, yes, it's correct, but your certification is going to depend if you are not in the US or Canada. If you have a local lifestyle medicine society, your certification primary issuer is going to be through them. And we have so many around the globe now, so you'll want to check with us if you're not sure, and then we'll connect you with that society. If your country does not have a lifestyle medicine society or certification, can be through IBLM, and that's offered at prometric testing centers around the globe as well.
Yeah, and
Great.
I'll add one component of clarity. We do have some international physicians that are living in the US, and they're wanting to know if they should sign up for if they'll be ABLM or IBLM. And really the distinguishing factor is if you've gone through residency and have a ABMS, American Board of Medical Specialty, in the US and have completed residency and taken those boards, then you can sit for the ABLM exam and be certified by ABLM. If you are a physician in the US without having gone through residency and having an ABMS in the US, then even though you're in the US, you would still qualify for IBLM. Do you have anything to add to that, Beck?
No, I think that covers it.
Okay, great.
And Beck, I know you did cover this, but just to reiterate the timing, because the conference, the ACLM conference, which is one of the eligible or accepted event CME events, that because it is happening in November, so close to the exam deadline, just please reiterate that it is still eligible for certification in 2025.
Yes, absolutely. It is an exception to our rule. While we like to have prerequisites 30 days prior to exam weeks, we always accept conference attendance earned immediately preceding exams. And we will have a lot of candidates submit receipts in our application system, and we ask for that to not occur because it tricks us into thinking the application is complete. So it's not a problem at all. You can register for the exam by September 30th and still complete the conference in Texas, and then you'll still be able to submit that when you earn it.
Excellent. Brenda, here's one. Does the 8-hour board review question bank count as part of the required CME?
Oh, that's a great question. No, it does not. But there are people, especially in the experiential pathway, who want extra study material. So the CME board review questions are helpful from that perspective, but they do not count towards certification requirement eligibility.
Great. I have one here who is a retired physician, no longer board certified, but is teaching as an academic. Is that something that is eligible for certification?
So in that circumstance, your primary issuer of the certification would be IBLM. As Brenda mentioned, to be ABLM certified, you need to have a primary board that is current and have to be established for 2 years or more.
Great. Excellent. We have several questions from mental health professionals. So some have masters in mental health, and then some are psychiatrists, like doctors in psychiatry. And it's very interesting that this is something that is being more readily accepted in the mental health fields. Brenda, do you see that certification in lifestyle medicine is helpful for this discipline and specialty?
Oh my goodness, yes. Incredibly helpful. We have so much evidence about the power of lifestyle medicine for mental health and behavioral health. So yes, it's growing and growing. And actually this year we have a tremendous amount of lifestyle medicine being integrated into the American Psychiatric Association conference that's coming up soon. And so I think you're going to find that the interest and the need for this is going to be very tremendous. Nutrition, physical activity are very powerful therapeutic modalities for mental health.
Wonderful. Here's another one, Beck. The annual recertification requirements. You did touch on maintenance of certification, but can you please just make sure that there's an understanding of the annual requirements?
Sure. So the invite to join the program will go out in January following your initial year of certification. So if you become certified November this year, you'll get an invite through March 31st of the subsequent year to join the program. You have to complete 3 articles on our platform. These articles are not tied to CME. They're just a separate component. They each have 5 questions that you have unlimited attempts to answer at least 80% of them correctly. And then every 5 years in the program, you have to submit 30 lifestyle medicine specific CME. And then there's also the annual payment. And the annual payment is what opens up your ability to participate in the other activities.
Great. I do have a question that is kind of relevant to everyone on the call, and that is about follow-up information or contact information. And as you can see on your screen, there is an email, the info@ablm.org, that will be answered by Beck personally. So any questions around eligibility and specificity for your situation can actually be directed there. And we're so excited that all of you have interest. There are hundreds on the phone, on the webinar today, and we're just could not be more excited about all of the interest.
Leslie, I'll clarify that the info@ablm.org might not be responded by me personally. Our board's executive director may respond. If you're a physician asking questions, if you're a health professional asking questions, I will be the responder.
Okay, fantastic. The point being, someone in person, an actual person will respond to you.
Yes.
Let's talk a little bit about studying. What do you find is an adequate time to allow to prepare?
So I will provide my response, and then Brenda, if you'd like to add your insight as well. This varies so dramatically. I've seen candidates prepare anywhere from 3 months to 12 months, which is highly dependent on the knowledge you already have, whether you've already gotten any of your CME, and how much time you personally have to dedicate to your studies, and then also your style of learning. So it's highly dependent on a number of factors, but on average, we see, I'd say more like 6 to 12 months, but if you're incredibly ambitious, as little as 3 months, but I would recommend that at least 6 months.
Yeah, that's spot on, Beck. I don't have anything to add.
Okay, wonderful. We do have a couple of questions about the practice of lifestyle medicine. So just kind of clarifying that something that you did bring up, Brenda, that more and more health systems and clinics and even payers are looking for lifestyle medicine certified clinicians to hire. Can you speak a little bit more about what certification really means to employment and employers?
Yeah, I would say it's something in process, and there's no guarantees. But what I will say is that out in the market, we have a whole department within ACLM that really is working on practice advancement. And what we're finding is that in the marketplace, we have more and more um, corporations, large health systems that are actually looking for and wanting to implement hiring of people who have lifestyle medicine certification and or help their employees that they already have to become lifestyle medicine certified. Just because we understand and we know that lifestyle medicine needs to be the foundation of our healthcare system, that we're failing dramatically in how we care for our population, and that lifestyle medicine is the answer for this. And so I think a lot of health systems are starting to recognize this. There's also an emphasis nationally, as Susan mentioned, in moving more towards lifestyle medicine as being the foundation of our healthcare system as well. So I think as our health systems are waking up, they're going to be looking for these types of certified professionals, and realizing that lifestyle medicine is a team sport is what I say. We need all health professionals and physicians working together as a team, pulling all in the same direction. And so as our systems recognize this, they'll be looking for this certification. The one caveat is that this may or may not have a financial incentive. And we need to recognize that you may not get paid more for having this certification, but the satisfaction of knowing that you're practicing differently and that you're actually helping patients on a different level and helping to implement change for that patient, giving them hope. Really, to me, it's you're giving the patient hope of levers that they can pull differently than what they've normally been told. To me, this is huge, and it gives you that competitive edge for the organizations that are looking for certification.
Great. Thank you.
Mhm.
Beck, one more question for you. Prometric. When would people be expecting to kind of hear about the testing locations or plan for, how to arrange their testing?
So we do have a link with our Prometric. I don't have it handy at this moment exactly, but we have a link that you can search in advance to determine if you have a local Prometric testing center, or you could just Google it. Any Prometric center that is open, the exam will be available there. Or you could just email us and we'll get you the link.
Excellent. Thank you so much.
Mm-hmm.
So let's see if we've had so many, such good engagement. So I'm super excited. I think that really it's about reiterating that the list of accepted continuing education courses and the list of accepted continuing education events are all on the IBLM website. Under the certification link, you can click on eligibility and prerequisites and get a list of everything that is available to you to help you prepare and study. I think some of the other questions that we have are very specific, so we do encourage you again to write to info@ablm.org. And just as we wrap up, we want to just say that how excited we are for all of you to pursue something in your careers that will not only help you professionally, but help your patients and help them achieve better outcomes, and really focus on how we can treat the whole person and put the patient at the center. So we are excited. Beck or Brenda, do you have any final closing comment?
One question that I wanted to answer, I saw somebody asked, a registered dietitian asking if they can sit for the exam. So there is a handful of fields that have been grandfathered into certification eligibility, such as registered dietitians, PAs, NPs, PTs, and OTs, and pharmacists. And that's because they once required a bachelor's degree to practice. So as a registered dietitian, yes, you are eligible for the lifestyle medicine professional tier of certification. Just wanted to clarify that.
Wonderful. Thank you. That's very important. Brenda?
Yeah, I would say as my final thoughts, that I would encourage you guys to really take this seriously, think about it. I think it's going to be life-changing for you and personally and professionally, and for all of the patients that you touch after you become certified. So I would say take the dive, and now's the time. So go for it.
Excellent. All right. Thank you guys so much. Thank you everybody for joining. We will see you next time.